So in the past few weeks, you've suspected pregnancy, you took a home pregnancy test, it was faintly positive, and then you went to the clinic and they did a urine test, it was negative, they did a blood test, it was negative, and so you're wondering what happened. And it is possible to get false positive results if you read a home urine pregnancy test outside of the time frame recommended by the manufacturer of the test. For example, most manufacturers say that you should read a home pregnancy test result within 3 to 5 minutes after taking it. And so a lot of women will look at it, it's negative, and then they set it on the counter or throw it in the garbage and are tempted to go look at it later. And if you come back outside of that time frame, it's possible that it could be slightly positive, but that's a false positive. So again, any result that you see outside of that time frame recommended by the manufacturer of the test is not reliable. It's good that you called your doctor when you had some questions and that you got checked out. And again, when you had a negative blood test result, that is the most reliable result you can get. Basically, it comes down to this. Early in pregnancy, your body starts to release a hormone called human chorionic gonadotropin, or HCG, and these levels rise exponentially until they peak around 8 to 11 weeks gestation. And so early on in pregnancy, like within the first week after conception, HCG levels are so low that it's hard for a blood test and a urine test to detect them. But 1 week after conception, a blood test will give you a positive or a negative. There's also another type of blood test that can give you an actual number. It can quantify the amount of HCG in your blood. And 0 to 5 is actually normal. That's considered negative. So it could be 1, 2, 3 and still be considered negative. If it's anywhere from 6 to 25, that's uncertain. And most doctors will recommend redrawing the test in a couple of days. If your HCG levels are above that, then it's a positive result. And again, these test results can be accurate within 1 week after the time of conception. But a home pregnancy test won't detect pregnancy until at least 2 weeks after conception because it takes longer for the amount of HCG to get high enough in your blood that it spills into your urine and can then be detected in the home pregnancy test. Now, you also asked if the birth control pills that you were taking a little while ago and then stopped taking could have affected your results. And birth control pills will not affect HCG levels, but some women do receive HCG injections for fertility, and those can affect their home pregnancy test results and should be taken into consideration by a provider if a person has been receiving those types of fertility treatments. I recommend following up with your healthcare provider who has a knowledge of your circumstances and history, and based on their knowledge of your circumstances, they'll be able to determine if you are indeed pregnant or if you aren't and give you the final answer. Good luck with everything, and if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.